you can, the next slide. So to kind of emphasize, the brunt of this disproportionate impact, I've borrowed this slide. Oh, I think we skipped one. If you can go back one, please. Right. I've borrowed this slide from our friends at the Health Policy Institute of Ohio. They're a great organization. I really respect their work. And they have this chart in one of their reports that talk about modifiable factors that influence health. And I wanted to show this primarily because there's underlying societal issues, including, remnants of structural racism, and also structural racism that, exists today in our public policy that result in many of the disparities that we're seeing with health, economics, education, et cetera. And as you can see here, looking at some of the health behaviors like physical activity, nutrition, society and economic, environmental factors, these are all things that contribute to overall health and are somewhat modifiable. But I think a big issue here is that that's all dependent on the resources and your ability to do that. And not everyone in our society, has that access. If you can switch to the next slide, please. So what brings us to this conversation here is that, early on within this pandemic, knowing what we know about systemic racism and disparate health outcomes in many in our society, we knew that there would be, disparate outcomes with this current pandemic. And so I wanted to share this chart from the Ohio Department of Health, which was also cited in another newspaper article, showing the breakdown of cases and deaths from COVID-19 amongst different segments of our population by race. So, just take a moment, take a look at this. But I mean, what you can see is that disparate outcome is, and also treatment and access to is apparent right here. And it's also fair to acknowledge we're not testing everyone. So this is not a complete picture. If you can go to the next slide now. So as a result of many of the things that we were seeing in the environment and what we anticipated would be happening, many organizations that we are partners with, we joined together to issue a statement to the administration detailing our concerns around health disparities in this pandemic, and also to put forth recommendations for what they should be focusing in on and doing right now. And I'm really proud of the organizations that we partnered with. And even after this statement was issued, there were so many other organizations who also said, we're totally with that, or with you all on that statement as well. And several others also issued similar statements. So we stand very much in solidarity with all of those organizations. But just a special shout out to UCAN Ohio, Centers for Community Solutions, Advocates for Ohio's Future, the Ohio Poverty Law Center, and Noble, and the Ohio Federation of Teachers for standing with us on this. So some of the recommendations that we laid out there was, and I'll just run through each of them, were number one, to assure that all COVID-19 data had full reporting of race and ethnicity, and work towards that same goal for all public health and Medicaid data reported by the state. And this is important because, with data, there's full transparency of what is going on currently. And I think with data, we can also identify areas where we're falling short and where we need improvement. And without that full transparency, we're kind of in this, the quagmire of the unknown. The second piece was to assure the medical triage criteria and procedures for allocating scarce resources does not discriminate against vulnerable populations. So what does this mean? This means everything from, making sure that there's adequate testing, to treatments, to, the ventilators. And of course, this is, kind of wide ranging in this particular recommendation. but making sure that individuals are not treated differently because of where they live and what access, what access is available in that specific geographical area, or, especially in those areas that are predominantly, African American, Latinx, or low income. The third piece, examine the Medicaid testing and treatment data and look for differences in race, disability, and geography to get a fuller picture of disease impact and disparity. So this is data that we have yet to examine, but again, this is important, especially when you have such a large percentage of Ohioans being covered by Medicaid. The fourth item around assuring that serological testing to determine exposure is done through sampling of the Ohio population and oversamples by race and ethnicity to assure estimates can be made disaggregated by race and ethnicity. You can go to the next slide, and I'll just run through the remaining, and then we'll talk about where we are in terms of the status of each. The fifth recommendation was examining utilization of nutrition, cash assistance, housing, and other programs pre and post-pandemic. And again, this gets to the question of access, right? And which areas of our cities, of our state, and who are receiving access to that nutrition, to that cash assistance. Several slides ago, talked a little bit about disparate outcomes, and much of that is a function of where we're living, which neighborhoods have what assets, and whether or not they have access to those resources that they need. Number 6, analyze unemployment and unemployment compensation data and SBA loans information to determine whether employees and businesses in communities of color have been left behind. And this is really, really important, specifically because many of our small businesses, and especially in those areas of our state and our cities where divestment has occurred over generations through policies like redlining. This is important to make sure that they're getting access. These small businesses are getting access to the same capital, the same type of, everyone's hearing about the payroll protection, getting access to all those different things that they need to survive as a business, as an employer. And we want to make sure that, they are not being harmed disproportionately as a result. And so having, again, access to that data is important. Launch a statewide public education and awareness campaign to reach our most vulnerable populations so they know how to access benefits to keep their families healthy and safe. Again, another important aspect is building awareness. I really love how every day, it used to be every day, but at the 2 o'clock press conference, this Governor DeWine, he had a sign language interpreter. I thought that was a great step in making sure that what he was saying was accessible. And then several weeks later, we had simultaneously, Spanish translations of those messages. Again, really, really important. And I know there's great organizations around our state, for example, Chris, who are putting out messages in different languages for our new American and immigrant populations. But beyond that, I think that, for broader populations as well, not only do we have to have that public education awareness campaign, but also, again, letting them know how to access benefits and how to access things that will keep their family healthy and safe. And, there's another part of this. I mean, it's beyond the knowledge and awareness, obviously. I'm not tone deaf to the fact that some people are better economically able to keep themselves healthy and safe. But, I think that needs to be a component in there as well. And number 8, assure that as Ohio moves forward with COVID-19 sampling, that the Ohio Department of Public Health use a methodology that is proportionately stratified by geography and demographic data to provide statistically relevant inferences. So I'm just going to move forward now on some of the recommendations and what the status is. So first off, I thought this was a really important first step for us to start tackling some of this. But on April 20th, Governor DeWine established the Minority Health Strike Force chaired by Ursula McElroy, Director of the Department of Aging. So the establishment of the strike force, I think, was really important in that you brought together state and community leaders who are leaders in our community, who are credible voices for many of our communities of color, and also can speak from experience and also from the work that they've done, within those communities to advocate and to also navigate, the tricky thing that is state government and also investments that need to be made. So they've had a couple meetings so far, and I know that they've broken up into certain co-chairs. I just had a check-in call with one of the members this morning just to get some updates. And, one of the first things that they talked about when they set up this commission was the breaking out of the committees, but also a public awareness campaign, because they knew immediately getting relevant, credible messages out there to our communities was important. So I still need to get an update as to where they are with that, with the contract for the public awareness campaign, but that is moving. If you can go to the next slide, please. So that was recommendation number 7 in the letter that we issued to the administration. Now, recommendation number 8 was really about the serological testing. And as of recently, we've learned about the Department of Health doing some random testing of about 1,200 Ohioans to get a better idea of COVID-19 spread. From what I've read of the testing that's being planned, it's being, there's postcards that'll be sent out to individuals randomly throughout the state of Ohio. However, everything that I've heard to date, and mind you, there might be some updated information that's been released since I last looked, but everything that I've read to date has focused on the geographic diversity rather than the diversity of the individuals that'll be tested. So that'll be something that we'll be keeping a close eye on and pushing forward with additional questions to the Department of Health and the administration to make sure that we have that. As of yet, for the other 6 pieces of information that we're also asking for, the recommendations, there has been, I think that there's just more progress that needs to be made going forward on each of those. And obviously some more disaggregated data in terms of who's getting access to testing, who, not just who's being tested, but who's also getting access to it. And, as we get more information and there's more testing that's being conducted throughout the state of Ohio, seeing what additional information is needed and how we can break that out by, geographically, maybe by county or region, to get a better sense of, either, disparate action, lack of disparate action, maybe it can be even, what are some great things that are coming out of this in terms of lessons learned and how we've reacted or responded, to some of these concerns. Oh, excuse me. But I'll just end right there. I think I might have another, I think that might be the end of my slides, and I can pass it off to the next. Oh, there we go. Sorry. As I've mentioned, we'll be monitoring the rest of the progress with these and advocating. So thank you very much, and I'll just stop my comments there.
Hello, can you hear me?
Yes, all set, Kyle.
Fantastic, fantastic. Well, it is an honor to be here today, and thanks so much to be on this wonderful panel with some really great panelists. And really, what I'm going to do today is I'll turn on my video. So I'm just going to tell you a little bit about some of the work that we've been doing at the Kirwan Institute for the Study of Race and Ethnicity, and its impacts, especially in the midst of the COVID-19 pandemic. So first and foremost, the Kirwan Institute is a research-based center at The Ohio State University that focuses on how do we address disparities by looking through the lens of equity. So we look at this through two lenses. One is race and cognition. That is things like implicit bias, unconscious bias, those unconscious attitudes and stereotypes that people might have, as well as looking at it through the other lens, which is structural racialization. That's the influence of our country's history, our laws and policies on perpetuating inequality. And the reason these are important is because we cannot look at these issues in a vacuum. All the issues that we're facing, these disparities are the result of an unjust history of discriminatory laws and policies combined with the very real unconscious attitudes and biases that plague our communities and that lead to disparate outcome and disparities. And so the work that we do at the Kirwan Institute entails a whole host of different avenues. The first, our new executive director who came on last year, Dr. Derek Hamilton, is an economist and a scholar that studies social stratification and stratification economics, which looks at how one's identity and how it relates to grouping has an impact on inequality. And this is especially important when we look at the economic impacts, but also the health impacts of the COVID-19 crisis. You know, we just heard some incredible statistics and incredible pushing that's being done right now by the Children's Defense Fund, and it is critical for all of us to be hands on deck to address this crisis. And as we move forward, we have to have some deep conversations about why it is that we are in the place that we're in right now and what it is that we can do to build a more equitable future and ensure inclusive recovery. Because we know as a result of these unjust policies and practices that have been implemented in the past, we are going to see more and more disparate impacts on Black and Brown communities. After the Great Recession, we saw that Black and Brown communities took longer to recover from that crisis and are typically in recessions and economic downturns, the first fired and the last hired. And so this has deep impacts on both the health and economic quality of life for our communities, and we have to address that crisis head on. Couple of things we're doing at both the state, local, and national level. So at the local level, it's working with local health departments, the Columbus Public Health, Franklin County Public Health, about looking at how this relates to existing comorbidities like heart disease and other chronic conditions that make communities especially susceptible to this virus. And we know that we see, again, as Tracy just highlighted, disproportionate impacts on Black and Brown communities that have higher rates of comorbidities and represent nearly a third of coronavirus cases across the country. But Blacks, for example, only represent less than 14% of the population. And so when we talk about these issues, the only way that we're going to be able to spur the type of change that is necessary to ensure, one, that we're getting adequate treatment and access for our communities is to be honest about the policies that we're putting in place. We cannot, especially right now, this could not be more of a timely discussion when we are literally having a conversation about reopening the economy and reopening society. I believe it's premature. And I know we are trying to do this with a lens of science and public health, but I also know that we're pressured because our economic activity is suffering. Businesses are suffering. Workers are suffering. But this is also particularly difficult when things like childcare, and I know we're going to be opening up childcare centers at the end of the month, but still you're going to see far too families that are not going to be able to send their children to childcare, and they're having to make the difficult choice of going into work and potentially risking their lives in face of this virus, and also needing to have the opportunities to protect and take care of their children. Disproportionately, those who are on the front lines, essential workers, Black and Brown communities make up a disproportionate share of those essential workers that are on the front line. And so we have to ask ourselves, when we're putting people with these difficult choices, what is it that we can do at a federal level to address this crisis. Because right now, many states and local governments are in desperate need of resources to help stave off the virus, but also provide economic resources and economic relief to families. States and local governments cannot do this alone. The federal government must step up in both comprehensive testing and a comprehensive national testing and contact tracing program. That is a critical piece that needs to happen. We are not there yet, and we need to get there. And in the meantime, there are actual policies that can be put in place to ensure that people are whole during this crisis. While it was an important one-time payment of $1,200 for the stimulus checks, economic relief, that is not nearly enough to handle the brunt of this crisis. We think it's important to provide more resources to families, direct cash payments to families, especially those who are having to face eviction or having to cover childcare costs or having to cover other sorts of costs when they're already burdened economically. So we have to ask a question about our safety net. We have an inadequate safety net that is here as the result of policies that put us in this place that talked about austerity and deficit, and instead of spending on social programs that are critical to our communities, especially Black and brown communities, we've cut those programs over time. And as a result, we were inadequately prepared to deal with this pandemic. We're also inadequately prepared to deal with the crisis, any future crisis. But what's important for us to highlight, and this is something that myself and Dr. Derek Hamilton and others at the Kirwan Institute have been talking about, which is that the vulnerability that has been made vivid by COVID-19, all of us are vulnerable to COVID-19. We shouldn't just be a more humane society and government during times of crisis. We need to make sure that we recognize the everyday vulnerabilities that people go through regardless of whether or not there's a pandemic. And because there's a pandemic today, it has only further complicated their lives and has created the crisis that we see. And so when we ask ourselves, what is it that we're going to do? We shouldn't be talking about, well, how are we going to pay for it only when it comes to providing social services and programs to people in need, but turn a blind eye when it comes to giving big tax cuts away for billionaires, for example. This is why it's important for us to have that serious conversation that if we're serious about caring for essential workers, if we're serious about caring for the people who are on the front lines of this crisis, it requires a government and a social safety net that doesn't put the burden and onus on the individual, but looks at the structures and the systems that keep people from thriving. There is a narrative that is going across not just the state, but all across the country that the situation and conditions that people are in is the result of their own problem and their own fault, and they are on their own in figuring out a way to recover. We have to push back against this narrative that is not only has racist tropes to it, is often sexist, is a problematic narrative that puts the blame on individuals and not where the responsibility should be on, which is a government that is supposed to provide for its people, especially in these times of crisis. Because we can show you all the numbers in the world, but if you don't believe that a Black person or another person of color deserves the same rights and opportunities as anybody else, then you're not going to invest in the policies that matter. So we need policies like guaranteeing income for people through the duration of this crisis. We need policies like ensuring, as Tracy just mentioned, disaggregated data so that we can actually highlight the disparities that persist and exist. And we also need to make sure that people have quality access to healthcare, because we're hearing a lot of talk about freedom, and people, a lot of protesters are out there talking about, well, we want to be able to reopen society and we shouldn't have things closed down. I want to do whatever I want to do. And yet when we talk about freedom, we have a very twisted sense of what this freedom means, because freedom doesn't mean much if you actually don't have a choice to be a part of an inclusive recovery. If you don't have money to provide for your family, you're not very free. And so we have to disregard and push against this you're on your own mentality and support the communities and leaders like those on this call who are pushing for policies that say we're all in this together. And that means all of us. That means telling the truth that We need to put together task forces about those who've been left behind. For example, it is critical that we put together the minority strike task force, but we also need to be talking about putting together task force and recommendations for those who are in prisons and our jails, because mass incarceration has also led to an additional crisis, and there are too many families who are in our prisons and our jails and have been forgotten about, and disproportionately those are people of color. So we need to address those issues. We need to talk about those families, and we need to lift their stories up, because we say we're all in this together, Ohio, but too many of us are actually being left behind by our actual policies and our actions. And it's up to us to step it up. Thanks so much.
Hello, this is Charlita Tavares. Thank you very much, Kyle and Tracy, for your presentations. I first want to thank the Center for Community Solutions and Advocates for Ohio's Future for having this Friday afternoon panel to discuss issues around COVID-19 and addressing the disparities within our communities. I'm Charlita Tavares. I'm the Chief Executive Officer of Primary One Health, one of about 55 federally qualified health centers and lookalikes in the state of Ohio that are a part of the war on poverty that came out in 1965 to address the healthcare needs of Ohio's underserved populations. We serve over, and you can go to the next slide, we serve over 48,000 patients as a healthcare center here in Central Ohio. Our vision is quality healthcare for everyone. We focus in with our mission on those who are marginalized within our community and those who are experiencing barriers to healthcare, whether it's financial, social, or cultural barriers to healthcare. We have 11 health center sites in Franklin and Pickaway County. 10 of our sites are in Franklin County and 1 is in Pickaway County in Circleville. We're the oldest and largest federally qualified health care center in Central Ohio. Next slide. Our staff, we have about 300 employees, including 90 practitioners. The war on poverty out of the Lyndon Baines Johnson administration really wanted to attack the issues that we're dealing with even today. Social determinants of health, education, employment, healthcare, housing, the built environment, all of those issues that are disproportionately impacting the health outcome of residents. And so one of the mantras out of that war on poverty was nothing without us or about us without the people who are impacted at the table. Our board of directors, as part of the requirement of a federally qualified health center or what's known as community health centers, requires that 51% of our board members must be patients. Up until this past Monday, 12 of our, we had 12 board members and 7 were patients and 5 were non-patients. One of our patient board members, in fact, it was our chair, her term expired. So we're now recruiting additional patient members as well as non-patient members, but we're still in compliance. 6 out of the 11 board members are patients of our health center and 5 are non-patients. That's critically important as we look at COVID-19 and the impacts disproportionately on persons of color. Our patients, and I'll get to that in a little bit, reflect the disproportionate populations in our community who are suffering from COVID-19 and other diseases and illnesses. So we have 1 special advisors, 11 voting members. Next slide, please. These are the services that we provided before COVID-19 and the services and how we're providing services after COVID-19. We still provide some face-to-face visits, but most of our services have gone to telehealth, including our behavioral health, unless the practitioner believes that that patient needs to come in because we provide medication-assisted treatment. Some of those patients their practitioner believes that they need to come in for a face-to-face visit to keep them from going and using substances. We provide emergent dental, vision, as well as OBGYN, pediatrics, and you can see the other services. In addition, very few federally qualified health centers provide physical therapy. We use physical therapy not only for motion and injury, but also to complement our behavioral health services with pain recovery, utilizing our physical therapists. Next slide, please. I'm going to talk about our demographics before we get into the governor's minority health strike force. Our demographics for our patients, 2/3 of our patients are female, 1/3 are male, and approximately 1% categorize themselves as other, meaning gender identity, transgender, etc. 30% of our patients are at or below 100% of the federal poverty level. 2.8% of our patients are homeless. We have a healthcare for the homeless program, so we are serving over 1,100 homeless individuals within our community. 1/3, and it's a little more than 1/3 now of our patients are non-English speaking. Their primary language is a language other than English. And then we provided $8.4 million. This was in 2018. Our 2019 numbers will be available soon in sliding fee discounts or uncompensated care. We provide a discount drug program, our 340B discount drug program that saved our patients over $16.9 million in 2019, which is our most recent numbers. I share all of this because we are serving the populations that we're talking about. We are serving disproportionately communities of color. African-American, out of our patients, about 37% of our patients are African-American, about 30% are Latino or Hispanic, about 21% of our patients are Caucasian, and about 11% of our patients are Asian, Nepali, and Somali. So as you can see, these are the patients and the communities of color that are disproportionately being impacted by COVID-19. All of that is replicated across the state, particularly in our major metropolitan areas across the state, where disproportionately communities of color habitate. We do have communities of color throughout all 88 counties, contrary to what some members of the legislature believe. And as a former member of the Ohio General Assembly, both the House and the Senate, I can share that many believe they don't have communities of color or individuals who come from other cultures and beliefs. That's really important for us as we look at COVID-19 and look at what the governor's minority health strike force is attempting to address in the immediate future. The governor's minority health strike force is chaired, it's co-chaired, really tri-chairs. You have directors McElroy of the Department of Aging, which was mentioned a little bit earlier, but you also have Alicia Nelson with Recovery Ohio, who is also one of the co-chairs, and then Ron Todd, the governor's liaison for minority communities, who is the third co-chair. The task force itself has 29 members. There's also a 24-member state team that has been identified of state employees that are working on this strike force specifically, but also other strike forces that the governor has established. With the minority health strike force, 4 subcommittees were created: the data and research subcommittee, the education and outreach subcommittee, the healthcare subcommittee, and the resources subcommittee. The chairs of each of those committees are Melba Moore. She's a Cincinnati Health Commissioner. She chairs the data and research committee. Charles Maudlin, who's a physician at the Cleveland Clinic, he chairs the education and research subcommittee. I chair the healthcare subcommittee, and June Taylor, who is the chief of the Western Reserve Area Agency on Aging, chairs the resources subcommittee. The strike force has been given 2 deadlines. In fact, that was just given on yesterday that I can share with you. The deadline for our interim recommendations, our immediate recommendations, is May 21st. And then our final recommendations, which may be more structural, that some of us have been advocating for, is June 11th. I share that because I want us to reach out to organizations such as the Children's Defense Fund, such as the Center for Community Solutions and Advocates for Ohio's Future, to look at what are those structural issues that we need to address in the longer term. The immediate issues we need to address with respect to COVID-19 and those issues, those strategies, those programs or services that we can put in place immediately to change the trajectory of people of color disproportionately being impacted by COVID-19, and then those more structural policy program funding issues for June 11th. The problem statement, as you can see on the screen, were that communities of color, particularly African American community members, are disproportionately affected by COVID-19 and the illness it causes. The objectives of the strike force is to stop the progression of the disease, evaluate and document the impact of the disease, remedy factors that contribute to the spread, and procure the resources to prevent a resurgence. So that's more or less the objectives that were given to each of the 4 subcommittees. And as I just shared, there's a short-term or immediate strategies, policies, programs, et cetera, that we can put in place to tick off some of those areas to stop the disproportionate effect of COVID-19. What I'm proud to say of my county here in Franklin County is that our Franklin County Public Health Commissioner has just announced that they have adopted racism crisis. That was mentioned on yesterday's call with Director Acton, and she wants that to be one of the pillars of her department and the administration. So Joe Mazzola, the Franklin County Public Health Commissioner, adopted racism as a public health crisis. That's critically important for all of us as we discuss recommendations, strategies, and structural changes that are going to be needed in order to address not just COVID-19, but all the disproportionate impacts of disease and illness upon communities of color. I know that we want to take questions, and so I'm going to stop my comments at this point and wait for the questions that are coming from those who are on the call. Thank you very much.
Thank you so much to all of our speakers. This is Tara Britton with the Center for Community Solutions. Apologies for my own technical difficulties trying to join earlier, but I really want to thank everyone for joining us today, and thank you so much to our speakers. I know Ebony is going to help us walk through the questions. There have been several that have come in, but in just sort of summarizing a few of them, I think one of the things that I would pose to all 3 of our speakers is kind of next steps in how to take this into the policy advocacy world and really advocate for better, more equitable data collection, making sure that that data is informing our policy development and our policy priorities. So I think beyond what a few of you were able to touch on, I wondered if you had anything else to add in that space.
This is Charlita Tavares. I do think that oversampling is critically important if we're going to get the data that we need. And as Tracy shared earlier, we definitely need to collect data by race and ethnicity. And as I've talked to my friend and colleague in the trenches, Director Angela Dawson with the Ohio Commission on Minority Health, we need to also look at primary language and country of origin. As I shared with the governor's task force co-chairs on a call today, if we don't disaggregate the data, if we don't look at country of origin, a Somali individual coming into our community, and Franklin County has the second highest number of Somalis in the country, a person who was born in Somalia, who's an adult when they come into the county of Franklin, come in healthy, with no diabetes and no hypertension. I'm just giving you an example of a patient. After they've been here 3 years, eating the foods, not having as much activity of walking to and from as they did in their home country, the diabetes rate has gone up exponentially and the hypertension rate has gone up exponentially. So unless we get that data, knowing that that person spent the majority of their life in Somalia and they just came to the country, they're going to be lumped in with African Americans, all people of African descent. And that's not going to give us the information we need with respect to trends and tracking to better prepare treatment for individuals from various racial and ethnic communities. So that's why many of us believe country of origin is critical, because that gives you a time frame and it also pulls out a population that wasn't born and raised in America.
This is Tracy Nahida, and I wholeheartily agree with everything that Senator Tavares just stated, and also thank Director Dawson for all her work with the Minority Health Strike Force. On the data piece, it is so important, and the reason why I know that some folks, there is, and rightfully so, I think, criticism of some of the data that's being collected. I mean, you hear the old adage, garbage in, garbage out, right? If you're not collecting good data, you're not making good decisions. But I think that it's incumbent upon us to, push for good information to be collected, to make sure that it's representative of all of Ohio. As we've seen in other health, studies, where a lot of research was done on just one particular population, and primarily a lot of health research on white men, we don't get the full picture of how certain diseases or treatments, how they present with different populations, or, even with women. So I think that it's just so important that we do that and we get that piece right. And of course, I think incumbent upon all of us is to continuously make this call to prioritize minority health, to prioritize all Ohioans, especially those who were, struggling before this pandemic even hit, because we know that, and you've all heard this before, we're not necessarily all in it together, right? Some people are in luxury yachts and some of us are in dinghies, holding on for dear life. So we need a tailored approach to take into consideration all those challenges that different segments of our population's facing, especially right now.
Yeah, and I could speak to those points just to add on, on the community voice getting to legislatures. I know obviously our former state senator could tell us how to do that, the best way to have the legislators listen. And one of the important things that I can think of, that some of the work that we're doing, as while we don't participate in direct advocacy efforts as an organization, I know as an individual, there's a lot of things that you can do. One, we have to center community voice. Too often, community voices are left out of conversations. And so it's important for us to talk with those who are directly impacted, as well as giving them the opportunity, not only for us to lift up their stories, but for them to lift up their stories and the stories of family members. I think incredible example of this was Michelle Alexander's op-ed in the New York Times that looked at the stories of those who are in our prison system, directly impacted, and lifting up that voice. I know Ohio Organizing Collaborative, the Justice League, a lot of groups that are doing a lot of great work in this space to lift up those voices in particular. But we also have to talk about, as the former state senator just alluded to, about the fact that there are Black and brown populations all across this state. And no matter how big of a population they are in a particular area, they are there, and their voices deserve to be uplifted and heard. And there are a lot of folks right now, currently in our state legislature, that don't hear those voices. And we have to talk about things like reforms, especially in the midst of where we're at right now. We're going to talk about real policy changes. We have to have questions about voting and voting reforms, because we cannot continue to put the burden on individuals where they have to choose between their own health and safety and voting. Of course, we want to expand access to in-person voting opportunities that are safe, but we also have to be realistic and expand access to vote by mail, for example. And those are opportunities and reforms that could be made right now and that the state legislature can do things about, but action has not been taken on that front. That is critical. We need to be expanding access to vote for everybody. We need to ensure that not only can people vote by mail, but why aren't we sending people ballots, prepaid postage, directly to every registered voter for them to be able to submit their ballot? There's all this arcane processes that people have to go through, all these steps that people have to go through. We saw what just happened in our last primary, where you had to submit your application just to request for a ballot in the first place. You couldn't even do that online. We should skip all those steps and give people access, because the facts are that the reason we're here today is because all of these arcane procedures that keep people from accessing opportunities is not just by accident, right? These are intentional barriers that have been put in place, and people are hiding behind a system when we know we can make this easier. We can make it easier for people to access unemployment. We can do more to expand our social safety net, but we have gutted it over the last 20, 30, 40 years. And we have placed the burden on individuals. And we need to center community voice, encourage people to write op-eds, write to your legislators, and talk about these issues, because they are critical, and it could not be more highlighted this November. And of course, at the federal level, we need more investments into our state and local government.
Thank you all for your responses. That was really helpful. So I'm just I'm gonna go back to sort of some of the first questions we got here, and I will say that in the next 7 minutes, we are probably not going to get through all of these great questions that were submitted. So we're happy to keep a record of these, share them with the presenters, and try to get answers to folks who ask questions and we don't have time to get to them. So I'm just gonna head back up to the top of the list. And there's a question here around how do we plan to align public information from Ohio with data from the federal level. Tracy, you had indicated you wanted to respond to this.
Did I? Oh, I'm just kidding. You know, I think that, well, first off, I think that just getting correct data and just getting data in general is the first step. You know, we're seeing from a lot of national data sets, like the labor participation or, you know, the unemployment numbers that are coming down from the federal government. But what we're not seeing is that information, or at least I'm not seeing it yet at the state level. We're seeing it in the aggregate just to get a sense of, you know, what the unemployment figures look like, and, you know, how that will impact, or what are the needs, right, for different types of public services to meet the anticipated needs of those individuals and their families. You know, I think that it would be great to align these information, and much of the federal data is coming from the state of Ohio. But I think what I'd really like to do is first look at Ohio and make sure that we're getting the data that we need here to make, you know, decisions, to also gauge progress or lack thereof, and to triage, resources where they're needed.
Thanks, Tracy. Okay, this one came in for Kyle around a plan or discussion around addressing mental health and other behavioral health issues for people of color due to the social distancing and stay-at-home order.
Of course, yeah. So, this is a great question and just highlights some of the additional consequences of where we're at. I mean, we've already know that mental health is a big issue, and so when you add in all the various factors that come along with the stay-at-home orders in this particular crisis, that makes it especially difficult. I will say I think the governor and the Department of Health have done a good job of highlighting the need for more access to teleservices, for example, and telehealth, and that's a critical opportunity. But we also have to look at some of these other issues and really work with our social service agencies that are working with those who are on the ground and those who are in our communities who can provide those with the access and the treatment that they need, because not everybody has access to telehealth, right? And there are other things that we need to do. We need to address things like quality healthcare, ensuring people have access. And I'm sure the senator can speak more to this in terms of the availability of resources that are on the ground, especially for folks who are struggling with healthcare. But that's a key piece that we must uplift and highlight and not forget about as a result of all these impacts of this crisis. A great question. Thank you.
Thanks so much, Kyle. And Senator Tavares, if there's anything you'd like to add there, because I do see down here a more kind of specific question around the services around that you all are providing around behavioral health and how that's been adapted and kind of what you're seeing in terms of need.
Great. I would love to speak to that. We integrated behavioral health in our health center sites several years ago. And so not only do we do a quick screening of all of our patients, particularly new patients as they come in, but if the practitioner, the certified nurse practitioner or the physician, as they're discussing or treating the patient in the operatory, if they pick up on something that they believe needs to be addressed immediately, they will pull in one of the behavioral health clinicians into the operatory with them and then step out so that they can have a one-on-one conversation and then set up an appointment for a more in-depth meeting with that patient. It's important that you have the integration of behavioral health with physical health because it is health. And if you want better outcomes for the patients, you need to make sure that there is no stigma, and by having it integrated, there's no decision to go home and make an appointment. It can be addressed right then and there, especially if it seems to be more acute or more immediate in need to be addressed. So I think at this point in time when we're to be socially distancing ourselves from others, for those who live alone, for those who are already struggling with mental health disorders or substance use disorders, it's important that there is connection. We are applying for a learning collaborative with a funder now to test out even texting patients to stay as connected to them in between appointments, particularly those who are suffering from deep depression and or a substance use disorder that we don't want to be triggered into using again. So behavioral health, we're social beings, and it's not normal not to be interacting with folks. And so to touch those who already have been identified with a disorder, a mental health disorder, and to get them connected is critically important.
Thank you so much. So we are at 2:00. I want to be mindful of everyone's Friday afternoon. I want to thank our speakers so much for joining us today. I learned a lot. I feel like I have a lot of work to do. We all have a lot of work to do, and you've given us all a lot to work on and continue to think about in the work that we're all doing on a day-to-day basis. I want to thank everyone for joining us today. We really appreciate your attendance and your continued interest in these weekly webinars. I know we've had folks who've been on all of them, and then new folks who join depending on the topic, and we've really thoroughly enjoyed. As much as this can be a little bit of a tough environment, I think we've really enjoyed being able to connect with more of you around the state with this technology. So thank you again. Please join us next week. We're going to be looking at the issues that COVID-19 has presented for K through 12 as well as higher education. And it'll be same time, 1 p.m. next Friday. And then hopefully you'll all be able to get off to the holiday weekend next week. So thank you again. And we'll have all of this information on the Community Solutions website. I know Kelsey will be sharing it through Advocates for Ohio's Future. Any questions that we weren't able to get to, with several, because you all had a lot of great questions, we'll make sure to capture and share with our panelists, and hopefully can get some responses. I know some of the questions were around sharing additional reports and things that are likely in existence on all of their websites already. So we'll try to gather that up into our post-webinar email. But I want to thank you all again, Tracy, Kyle, Charlita. I really appreciate all of the work that you all are doing. Thank you so much, and have a great weekend, everyone.
Thank you so much. Take care, everybody.
Thank you.